I'm here with Berks County Commissioner Christian Leinbach. Commissioner, thank you for being with us today.
Very good to be here.
So how has Berks County been impacted by coronavirus compared to other counties in the state?
Well, we clearly, by looking at the numbers, are one of the more seriously impacted counties in the Commonwealth of Pennsylvania. When you look at 67 counties, and I'm very active with our state association, so I know a lot of the county leaders across the Commonwealth. A majority of them are not having real serious issues. Berks County is any given day number 4 or 5 in overall cases. We've also dealt with a large number of deaths. There's some discrepancy between our county coroner's numbers and the state, and that's not uncommon. There's been some confusion. That's all that I'll refer to that as. We're showing 123 confirmed COVID death certificates in Berks County, not probable, but confirmed. And right now, the state is showing 89 as of yesterday's numbers. The good news is in the last several days, both the deaths and the number of new cases have been declining. And that's critically important. We have been very concerned about some of the businesses, the life-sustaining businesses that the governor on March the 18th said could be open. Our concern was we think it would have been much smarter to focus on effective health and safety policies, and based on which businesses could implement appropriate health and safety policies, those are the ones that should have been allowed to be open versus what happened. For us, our grocery stores, our home centers and hardware stores, I believe became petri dishes for COVID spread. They were not following appropriate basic social distancing, wiping down of surfaces, masking. That has changed pretty dramatically. And I think there's a couple reasons. One, over 2 weeks ago, the county launched a campaign called Do Your Part Berks. And we have a website, doyourpartberks.com. That was designed, the posters were designed free of charge by a local graphic artist by the name of Kim Worley. And we really appreciate that. And the message there is, folks, we need to change our focus. We need to do what is necessary to make a difference in Berks County. And over the last several days, it appears that is exactly what's happening. We've started to celebrate businesses that are doing it right. So bad news, yes, Berks County is one of the more seriously impacted counties in the Commonwealth. The good news, in the last several days, the numbers are going in the right direction.
Is there any particular group or demographic that has been impacted the most by cases of COVID-19?
In the Commonwealth, it's crystal clear that the elderly and individuals with underlying conditions are much more susceptible to hospitalization and, unfortunately, to death. If you look at the deaths, and I've had, in my 13 years, I've never really had to look at death certificates. And since this crisis began, almost every day it seems like I'm looking at death certificates. Now, they are redacted, so I see the age, the gender, the race, the confirmation of COVID-19, whether they died in one of our hospitals or they died and it says a residence. And that addresses the second issue, where the county of Berks has been very transparent about our nursing home, the Berkside. We, from day one, when we had the first confirmed cases tested, it was among staff, 2 staff. We shared that publicly. When we had additional cases in staff and residents, we shared that publicly, not their names. And we made sure that family and our own staff knew first, and that we took appropriate precautions. We've been very open. We've had 1 confirmed death from COVID-19. But if you look behind the numbers and some of the more recent data coming from the state, 50%, about 50% of the deaths in Berks County are nursing homes. Now, some people, and I've read some harsh things in social media. If a person that passes away is your loved one, it doesn't matter that they're old. It doesn't matter that they have underlying health conditions. If they passed away from COVID-19, it's a concern for the family. And they sit back and they're wondering, what if this or what if that? Again, I've read some harsh things. They were going to die anyway. I can't tell you how many times I've seen that, and that is ludicrous. My mom is 93. My dad's 86. I have an uncle who's 100 years old and will be 101 in June. I don't know how much longer my mom might live, but she has a brother who's 100. She might have 7 years left. COVID, if my mom contracted COVID and died, it would shorten her life. And so that's the hardest thing, to realize that we have people dying. And by the counts from our coroner, 123. And those are confirmed, not probable. And by confirmed, they've been tested and confirmed as COVID positive.
What challenges do hospitals in Berks County still face?
Well, I believe, based on our working relationship with Penn State, St. Joe's, and Tower Health Reading Hospital, that we are likely past the surge period. My guess, based on the modeling that they have been doing and that they've shared with us, we've shared some of that modeling publicly. The challenge is every day as new data is put into the model changes. And last week, the model began to change for the good. And where we initially were thinking that the surge was going to be this week, it appears that the surge may have been last week and that capacity ended up not being an issue. And look, there are going to be people out there saying, well, I told you those models were wrong. This is crazy. As a county leader, one of the things I've learned is I just have to go with what I know today and understand it may change tomorrow. It's been extremely difficult getting, and I want to be careful to say credible, but we've seen the same problems at the federal level and at the state level and with other medical models that are out there. They're all over the place. They predicted much more serious outcomes than what most of us are seeing. And does that mean they were wrong? Not necessarily. It may be that they scared people into action. But the challenge we're facing right now are twofold. One, our local economy is getting crushed. And we need to reopen, and we need to reopen responsibly. And I'm not saying that means we need to wait till July. I'm saying we need to focus on masking. We need to focus on effective health and safety standards, washing hands, cleaning surfaces, social distancing. But we've got to reopen our economy. Every day I'm hearing from more businesses that say they may not ever reopen. And that means jobs lost. That means moms and dads not knowing how they're going to pay the mortgage or how they're going to put food on the table. There's some real challenges. Excuse me. The other challenge that all counties are facing, but it's especially difficult in counties here in the southeast and even eastern part of Pennsylvania, and that's the June 2nd primary. This is not going to be a all mail-in primary. There have been debates in the legislature and with the governor's office on that, but we are focused on going ahead with that election. We're encouraging as many people as possible to apply for, I almost said absentee ballots, but to apply for the mail-in ballot. And I encourage you to make sure it's a mail-in ballot. The absentee ballot still requires a specific explanation, and if it doesn't meet the standard, it will be rejected. The mail-in ballot does not require any explanation other than I want to vote by mail, and you can do that online. You can go to County of Berks elections, and you can apply for that mail-in ballot online. The other challenges we're having, we've lost a number of polling places. We had several that were in nursing homes that can no longer be in nursing homes. We're working very quickly to fill those polling places with new locations. And we've lost almost 440 poll workers. Many of our poll workers are elderly people that are susceptible to COVID-19. So we are working right now to fill those slots. We're going to be actually raising the pay that we provide for poll workers for Election Day. We've already ordered PPE equipment to make sure that our poll workers are safe, mask, screening, all types of materials so that we can protect the people that are working that 14 or 15 hour period on our polls. So those are the two big things that I think we're facing right now. Opening the local economy. We're encouraging the governor and the secretary of the Department of Health, Dr. Rachel Levine, to work with our county to allow us to get as much of our local economy reopened as possible. And we're also working very closely with the Secretary of State and elections to make sure that we're able to deliver reliable, secure elections on June the 2nd. And I'm confident that we're going to be able to do that.
And finally, what resources are available by the county to answer people's questions about everything coronavirus related?
Sure. Very early in this process, in fact, March the 18th, we opened a COVID-19 help center. We have live people answering phones and answering emails 7 days a week. The center is actually based at our Department of Emergency Services, and it is open from 8 a.m. in the morning till 5 p.m. In the afternoon, 7 days a week. We've also launched a campaign with a variety of resources for businesses and for individuals, and that's called the Do Your Part Berks campaign. Do your part, stop the spread. We have a website, which is doyourpartberks.com. We have a Do Your Part Berks Facebook page, and we're promoting good and common sense health and safety standards to limit the spread of COVID-19 here in Berks County. And if I can say one other thing, we are beginning to move into what we're calling phase 3. We believe that as we prepare to open some aspects of county government that either have been closed or services significantly rolled back, that we need to do that in a responsible way. And we're looking at 3 parts to that. Number 1 is short term, pretty much June through the fall. The second is our mid, and that potentially could be a difficult time, and that is the beginning of the flu season in late fall, where we may have COVID-19 on top of flu season, which we didn't have this cycle, through the spring of next year, and then working on what we call long-term, which would be spring of 2021 forward. We have a responsibility to our residents, to our taxpayers, in spite of the crisis, to be as fiscally responsible as we can. And the last thing our taxpayers need in 2021 is a tax increase because we weren't responsible in 2020. So all three commissioners are committed to doing the right thing by our taxpayers. And hopefully we'll see Berks County reopen soon and a continued decline of cases and deaths in this county related to COVID-19.
All right, Berks County Commissioner Christian Leinbach, thank you for your time.
Thank you.
We have three branches of government: executive, legislative, and judicial.
Voting is a civic duty. Voters are an integral part in government operations.
When I run for office, you can be my campaign manager.
Do you have a child curious about civic engagement? Support their passion with PCN Civics 101, a free online resource presented by the Pennsylvania Cable Network. Easy-to-watch videos take learners into the Capitol to see how our state government functions, meant to enhance your child's classroom studies. Go to PCNTV.com to start watching. PCN Civics 101, teaching Pennsylvania politics and policy.
I'm here with Dr. William Calo. He's an assistant professor of public health sciences at Penn State College of Medicine. Dr. Calo, thank you for being with us today.
My pleasure.
So what are we seeing as far as how coronavirus is impacting Latino communities in Pennsylvania?
The short answer is very simple. Hispanic communities in Pennsylvania are disproportionately impacted by COVID-19. And some quick data that I have is showing that here in Pennsylvania, almost 8% of the state population is Latino or Hispanics, but Hispanics account for over 11% of COVID-19 deaths in the state. So there's a higher number of COVID-19 deaths compared to the distribution of the general population here in Pennsylvania.
And what are some of the structural or social determinants that are contributing to these disproportionate outcomes?
There are many, and we can group all of them into three main buckets: differential exposure, differential vulnerability, and differential access to healthcare. The first one, which is exposure, that is more related to the occupation of the population. Most of the Hispanics, they work in grocery stores, in waste and recycling management, in cleaning services, working in hospitals. So those populations are low wage, but right now are at the higher risk of being exposed to COVID-19, not only to people, but also to surfaces. So they have a high exposure to the virus because mostly their occupation. The second factor, as I mentioned you, is vulnerability. And that one relates to many things. We always talk about age and having an a compromised immune system. But we know from some data that having an underlying health condition produce worse COVID-19 outcomes. In this case, higher mortality rates. And those are, for example, having diabetes or having cardiovascular diseases. Unluckily for many of the Hispanics, they have these chronic diseases, so they're more vulnerable to having worse COVID-19 outcomes than the general public. And the third factor that I mentioned you is differential access to healthcare. We all know that the largest racial ethnic group in the U.S. Without access to healthcare are Hispanics. So they're lacking access to needed testing and treatment.
And what role do community health centers play in providing that healthcare and the testing where it isn't accessible for most Latino communities?
I can tell you that not only the community health centers, but the major healthcare systems, all these people, all these healthcare workers are very committed, are passionate about serving the population. So things like, for example, if you are an undocumented immigrant, that's not a problem. People should not have any fear to go to any of the hospitals or community health centers to get a test or to receive the medical care that they need, especially in these critical times. So I can tell you that they're playing a big role, whatever capacity they have for testing, but also educating the community. They have a lot of patient navigators, community health workers who are informing the community, and also at the same time doing a lot of outreach to make sure that everyone who has symptoms have access to the test that they need.
COVID-19 has also had a significant economic impact on all of us. Has the impact on Latino communities been as disproportionate economically as well as physically?
Completely, yeah. Two main things. One is that there's some recent data about the proportion of different racial ethnic subgroups access to telecommute or work from home. 84% of Hispanics are not able to telecommute. 84%. That's the largest number in the U.S. So for most of these people, or you show up to your work, or you don't get any payment. And that put more people into the second aspect of all this economic burden or disparities, that they will not have access to many of the federal economic recovery benefits that are available at the state level or the federal level, at the same time unemployment benefits. So many of these people, if they're not able to telecommute, most of them cannot, they're not able to get any paid, they will not able to be up to date with their bills, so they will be relying in a lot of the local and community resources that they have, if they have any.
How are people in Latino communities or just generally marginalized communities able to receive accurate information about the virus and how to deal with it and what resources are available to them?
That's very important. And this is a topic that is not only specific to Hispanic communities. They have some issues, most of them with language. Okay, most of them are not English proficient. But I think we have a COVID-19 pandemic, but we have a second pandemic, and it's the pandemic of misinformation. Okay, and is a lack of information or straightforward information, not only for Hispanics, but if you put on top of that, on top of the misinformation, that the information is not available in Spanish, okay, that's a huge problem, okay? Many information, we're relying on the internet to get many of the news in addition to traditional news. So just imagine that on top of that, we have in central PA, many of our rural communities don't have good access to internet. So that put another burden of how people access information. So of course, someone said, I heard something, and they repeat an information, and maybe it's not the right information. That makes misinformation. So make some people more vulnerable to get COVID-19 because they don't have the evidence, they don't have the information to make the right decisions. And that's something that we're seeing not only with the Hispanic community in the state, but also in rural areas.
What is being done by the government, either on the state or federal level, to address some of these disparities?
There are a few things that are being done at the CDC. I can tell you that 6 weeks ago, when all these we start talking about stay-at-home orders and the real pandemic is here, I went to the CDC website, and there was limited information in Spanish, not only in Spanish, in other languages outside the traditional English language. Right now, you are seeing more information in Spanish and other language. So I think that's one of the most important things. And also here at the state, the governor created a COVID-19 response task force for health disparity, and I think that's really important because we know that the data is showing that not only Hispanic but other minority groups are having a hard time with COVID-19. So I think there's some actions, but I think the most important thing is information, and I want to emphasize that it's not only the state level, the federal level. It's information. We need to give the general public straightforward information, but at the same time, the state need to collect better information about race and ethnicity and occupation. We don't have, for all the cases and for all the deaths, we don't have that information. And that information is crucial to making the right decisions for public health, but at the same time, when we're talking about reopening the economy. So we need to have all that information. And right now, we don't.
You are also a co-director of the REACH project. Can you describe what that project does?
REACH is a large grant from the CDC. It's a 5-year grant. And what we're doing is impacting Hispanic communities in 2 counties, in Lebanon County and Redding County. And our work focus on improving chronic disease prevention strategies. So we're working about improving healthy eating, improving physical activity, and improving access to diabetes prevention programs in both Lebanon and Berks County. Something that I think is a positive note that we have noticed, not only in these 2 communities, but across the state, is that physical activity, it seems that has improved in the last month, the last 6 weeks. People are home and people are now have some free time or some time to do physical activity. People want to get out of the house. So we're seeing more people being physically active. And I think that's one of the things that after this pandemic ends, I think that's something that we need to continue pursuing, keep people out of the houses and do some physical activity.
As reopening begins across the state, what new challenges will we face as all members of the state and Latino communities?
Again, it's all about information and thinking about the use of medical masks, for example. 6 weeks ago, the data that we have, or the guidance that we got from CDC, where we don't need to use masks. So we discouraged the use of masks. That was something at the early March. However, this is a new pandemic with new challenges, and we're getting new evidence every single day. When the CDC got better understanding about the transmission and spread of the disease, scientists understood that the best way to stop the spread is using masks. So the guidelines changed, and now the use of masks were recommended in public places. So the state of Pennsylvania adopted those guidelines. 2 weeks ago, we moved a step further of that, and we're now requiring the use of masks when people go to public places. So I can tell you, and you can see that in a short span of 6 weeks, we have changed the guidelines 3 times. Okay, so many people are confusing because of that, and I can give you some other examples. So I think it is okay to change the guidelines, and I think it's going to be okay to change the guidelines when we decide to reopen our counties here in Pennsylvania, because we're getting new information every single day, and we're going to be making those decisions based on evidence. It's matter about how we disseminate that information so people don't get confused, including businesses. You know, many businesses right now, they don't know if they're able or not to open and the criteria for opening. So I think dissemination of information and how the state collect that information is so critical for every decision, how we reopen the economy and how we deploy our resources, limited resources for public health.
And finally, many of the issues that you've brought up have been impacting Latino communities and marginal communities for long before this pandemic. Will this pandemic affect how we address some of these issues of health equity in marginalized communities?
I hope so. I hope after this ends, we take into account the thing that we have learned. And I think health disparity is something that we have been learning here that is continue affecting some minority populations. But not only that, I think after this, I hope we gain a better understanding how important it is to get vaccines. Okay, in the future, maybe next spring, hopefully we will have a vaccine for COVID-19. I hope this is the time that we understand the importance of having a vaccine in place, and probably next fall, when it's time for getting your flu shot, everyone understand how important it is to get your vaccines and go to your medical checkup. So I think those are lessons that we have learned, and I hope those lessons carry forward when this pandemic ends.
All right, Dr. William Calo, Assistant Professor of Public Health Sciences at Penn State College of Medicine. Thank you for your time.
My pleasure. Thank you so much.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
We're the executive director of the PIAA, Dr. Robert Lombardi, and in my 14 years of doing PIAA championships, I've gotten to know you guys, as you and your staff, as some of the most detailed-oriented people I have ever come across. But I can guarantee you that there was nothing in the manual for what happened this year. Obviously changed the world of sports, changed everybody's life, quite obviously. But there was nothing in the manual for what to do, for what's happened in the last 4 or 5 weeks.
No, this has certainly been a different experience. And you're right. There's no manual for something like this. And it's very difficult for everyone because, you know, I know I say the same things all the time, and you do too. First and foremost is safety of not only students, but the coaches, the officials, the school staffs, the teachers, the faculties, the administration, and the communities, moms, dads, grandma, grandpops, everybody involved. But that doesn't mean that this doesn't sting a little bit, because we all like athletics. And being in athletics, this has been very troublesome.
Yeah, you guys were the PIAA state championships. I mean, you literally had to pull kids out of the swimming pool because the swimming and diving championships were already underway. The basketball, the boys and girls basketball state championships had reached the quarterfinals when the decision came down. But at the time the decision came down to stop, the decision was pretty much made for you.
Yeah, when the governor pretty much ended school for the remainder of the year and closed campuses, that really forced our hand. And understandably, but, you know, we were holding out hope because, one, we wanted to try to finish the event. We were just finishing up AAA. We did have to truncate a little bit by going to time finals. So I know that's not the best solution for people, but we've done it in the past when we've had some snow problems at Penn State as well as Bucknell. So people have accepted that. But then not being able to start AA was troubling. We think we may have a little bit of a solution there to try to at least recognize some students going forward. But basketball, you're right, we're in the quarterfinals, and we had to close up shop. And of course, spring sports went away, and I know people are very, very upset at that. But I think as of yesterday, I think the states are up to 41 or 42 that are all closed down for the end of the year.
But from your perspective, and I think this was one of the things that I don't want, you can use whatever adjective or adverb you want to describe in terms of being confused, being angry, being whatever the case may be. But from your standpoint, and the reason why I say your hands were tied was because initially the governor didn't close the schools for the entire year. Initially the schools were closed for a couple of weeks, but you were holding out hope that you could still at least try to finish up basketball and get spring sports started when the initial call came to just close school initially for the first couple of weeks. And then it was still only through the end of April that schools were initially closed. And so I'm thinking from your perspective, and not trying to get inside your head, but from your perspective, you're thinking, well, hey, if we get back in the beginning of May, we could probably still do something in terms of a spring season.
That's correct, Bob. You're right on the money. We were doing our best to try to take it, as he said, in a measured approach. We were taking a systematic, I called it a systematic day-by-day measured approach, because we were going to try to see if we could finish swimming. We were going to try to see if we could get some basketball games in and finish the championship events. I had conversations with some of our sites to say, hey, what's available? What can we do in maybe a little bit different fashion, even if we had limited crowds or no crowds? So there were some things that were in motion there that we were trying to save students' seasons. And we know how important it is to them. You know, not having to play your last season as a senior is very, very difficult. I get it. All of us get it, because not only did we have athletic careers, but our kids have had athletic careers. So we've gone to the gamut too. And yeah, we were kind of holding out hope a little bit and keeping our fingers crossed. And we were even looking at some really creative type things. But when the schools ended up being closed, that was the game changer. That ended it. And you know what? This is a very difficult time. And when I take my cap off to the governor and the Department of Health and the Department of Ed for trying to do the right things to make sure that people are safe. That's priority one, and we all believe in that. And we're muddling through, no different than anybody else.
I'm going to go back to the point you just made, and I think it's a very good point. And as much as it hurts me sometimes to say it, there's people who just look at the PIAA in the wrong light. Look, I've gotten to know you guys. They look at you guys as robotic, as a bunch of bureaucrats. You got no feelings. You got no heart. But I've known you in a different way, and you said it a moment ago. This is about the kids. You're doing this because you're trying to create opportunities for student athletes. And so, from your perspective, what made it hurt more than anything was the fact that student athletes were going to get denied an opportunity to get to the biggest stage there is, and that's a PIAA state championship. And you knew that essentially when this ended, the rug was going to get pulled out from under them, and it was something that you couldn't do anything about.
Yeah, and championships are one thing, but the bigger piece in that is, Bob, we have hundreds of thousands of students that participate every year that just play. They don't get to a district championship. They don't get to a district playoff. They might not get to a league or a conference playoff. But that doesn't mean that the lessons of athletics aren't learned. Teamwork, cooperation, persistence, perseverance, goal setting, overcoming adversity. Those things right now today are front and center with all of us as families. If you're at a stay-at-home order and you're home with your brothers and sisters and mom and dad, and you haven't been used to doing that because you have a busy schedule of going to school and doing this and that activity, student council, you may be in the choir, you may be in the band, you may be in future business leaders, all those things, mock trial, along outside of athletics, and all of that to come to a screeching halt is difficult. And we've seen it with our own children, and you've seen it with yours and your friends and your families and nieces and nephews, and it's troubling because those lessons are so important. There's, at the end of the year, let's just take basketball. There's 12 teams that are happy. 6 boys teams and 6 girls teams because they won their last game. Everyone else finished their season probably losing a game.
Right.
That's a difficult thing. But that doesn't mean the camaraderie and the lessons that you learned that were an extension of the classroom aren't valuable. Because we hear from kids all the time that say, those things that I learned have helped me in college. They helped me in trade school. They helped me in my job and as an employment. Because, there are days where I didn't want to get up to go to work. But you know what? Where I didn't like to get along with a coworker. But I worked through it because I was a teammate. And that's the thing that really probably gnaws at all of us because of being a shortened season. So hopefully we'll get up and running here for the fall. Hopefully things will turn out better for all of us health-wise. But our heart goes out to all those people on the front line and in hospitals and providing care and all that. And it's just funny to see some of the ESPNs and the television stations now stealing our thunder a little bit about perseverance and goal setting and overcoming adversity and being a good team member and using that as their highlighted advertisement because we believe in that every day.
Absolutely correct. And so the official date now is that everything is canceled through the end of June. June 30th is the end date for this season, this scholastic season as well. So, of course, now you alluded to it. Now everybody wants to know what lies ahead. And now everybody wants Bob Lombardi to be the ultimate soothsayer and tell them what's going to happen in the fall. Now, if you could do that, I'd rather have you give me the lottery numbers. But but nobody really knows what's going to lie ahead for September, October, November. But right now, you're going with the idea that the season will happen.
Yeah, we're operating right now under a standard operating procedure that we're going to start fall sports on time. And I think that's the right thing to do, but we're not even the May 1st. And you've just seen in the last couple of days how states have changed things and how people are getting optimistic about this and that. And, there's so far to travel. And to make a decision on April 28th that would affect August 10th is absolutely is poor judgment, and we're not going to do that. And I think that's the hardest thing in all this is having patience. And I've tried to share with all the people that I've come into contact with and interviews that we've done now, we need to have patience now because this is so fluid and so changing and so changes so quickly that putting out a plan and then it gets blown up just adds to more frustration and frustration to not only schools and people, but kids. And give an illustration, Bob, just quickly of one of our brother-sister state associations. They put out an elaborate plan of what they were going to do to restart, and they were going to do this and this and this and that on that date and this is how the events will look. And then they closed school for the end of the year, and that went all in the trash can. And boy, were people upset because you promised us this.
Right.
So I'm very cautious about putting anything out that would give anyone the idea that this is what we're going to do. We're taking this day by day. We're taking it in a measured approach, just like the governor said. We're relying on he and the Department of Health and the Department of Ed for some guidance. And as we learn those lessons going forward, we will make more decisions and get that information out because this is, like you said, there's no playbook for this one. This has really been difficult.
Well, we appreciate your time. We appreciate you keeping us in the loop. And as always, we appreciate being a valued partner of the PIAA. The PIAA championships and PCN have become a bit synonymous, and we hope to continue that for a long time.
We certainly do as well. We thank you for your time. And thanks so much for having me. Of course, you know how I feel about you. It's always good to be in your company, but thanks for taking care of us and helping us out, getting our message out to everybody out there. Thank you.
Glad to do so. The Executive Director of the PIAA, Dr. Bob Lombardi, joining us today.